Hi everyone, I'm Jahnavi and I'm so happy to introduce you to Raksha Rajesh. She has completed her MPhil. She's also done her MSc in clinical psychology from India, and I'm very excited to hear about her experiences because she's already had 4 years of clinical experience. And for the past 8 months, she's been practicing as a clinical psychologist and she's licensed. So that is really exciting and a great achievement. So thank you so much for joining today. And I just,
Thank you so much for inviting.
yeah, this is great. I mean, it was so good to have a conversation with you. So I wanted to ask you basic about like, especially people who are watching this for the first time or don't know what RCI is. A lot of students are like 10th, 11th, 12th standard students. So can you briefly speak about what is RCI?
Okay, so basically, if you want to be a clinical psychologist in India, you're supposed to pass your 12th, do your bachelor's in psychology, master's in psychology, slash applied psychology, or any other subfield of psychology, and then you apply for your MPhil entrance exams. So, what is the entire hype of MPhil entrance exams is because it is RCI registered. Now, what does that mean? Okay, so RCI is Rehabilitation Council of India. Now, imagine this as much as it's parallel to what we have for doctors. So, for doctors, we have Medical Council of India, the MCI. Similarly, for clinical psychologists, we have the RCI. That's the Rehabilitation Council of India. Now, with respect to all medical professionals, we have MCI numbers, which is like registration numbers, which basically talks about their education, which college they passed out, whether it is a legitimate medical college, whether it has been registered with the MCI, the quality of education. So the MCI takes care of the doctors there. Similarly, we have an RCI which takes care of the education, training, institutes, how they are certified by the RCI to provide a MPhil training for students who want to become clinical psychologists. And a lot of people have this confusion between ठीक है counseling के लिए RCI registration क्यों नहीं है as compared to clinical. Now, when a lot of people ask this question, it's I'm sure and I'm completely supportive of the fact that even counseling needs to have a regulatory body, and I'm sure it's coming up also. It's been getting developed. Uh, when it comes to clinical psychology, it is not only with respect to clinical disorders that clinical mental health disorders that you deal with. So you also are specialists in dealing with maybe post-surgery patients, pre-amputation counseling, um, transplant cases. So for that, you also need to know a lot about the clinical aspect of transplantation, clinical aspects of amputation, where your counseling will actually help them deal with their psychological distress. Now, to handle these cases, you need a regulatory body which also takes care about the training aspect of it. कि तुम कैसे students को train कर रहे हो, कौन से colleges में है, does the colleges or the university have an adjunct medical hospital also available? So ये सारा training aspect देखने के लिए we have a regulatory body called RCI. Now, another thing is RCI in itself is huge. So it doesn't only have clinical psychologists, it has special educators, speech and language therapists, audiologists. So सबके पास RCI number होता है because we rehabilitate the patient into the society. So we come under that profession, and that's why it's rehabilitation and not MCI.
Very helpful. Thank you so much. So that also makes me think of what do you think was the difference between just a master's and then you came to a MPhil? What was the
Yeah.
additional training that you got as an MPhil student?
So, masters, see, every masters is regulated by UGC, mostly in India. That UGC is there and it takes care of the curriculum. If it is a private institute, they have a different guideline. So, masters is not the same for like in India, masters in Delhi will be different from masters in Mumbai, will be different from masters in Chennai. Now, when we're talking about this, most of it is theoretical. Masters is you understanding theoretically whatever is given in the book. Sometimes in institutes, they have clinical trainings every semester where, okay, this is learned, you go and apply this in the internship period. Or sometimes in the last semester, like the fourth semester of master's, second year, is when you have 3 months of internship, 4 months of internship, where whatever theory is learned, you apply and you see what all you have learned. You gain a little more practical experience. Now imagine this in every day in your MPhil. So you see patients every single day. So you are nothing less than a medical psychiatric PG who sees patients every single day, writes notes, writes charts, writes plan of action for the patient, writes what has happened. So if they write medicines, we write our session notes. We spoke about this, we dealt with this issue, the patient spoke about some of their family issues. So you write all those things. So you are basically at the hospital without having, you always know you're in time at the hospital, but you don't know what time you're going to go back home. So it's hands-on, practical, clinical, hardcore training, which happens on an everyday basis. And that's what MPhil looks like.
That's really helpful. So, one question is, do you think people who have done like a distance learning master like IGNOU can also apply for RCI?
Okay, so again, like this question has been asked to me like personally a lot of times, and I definitely think they can apply. But not all RCI institutes are okay taking they consider the application form coming from students who have done distance education masters. So it can get really tricky. There are RCI institutes like RINPAS, which is in Ranchi. They are okay with accepting applications and giving interview chances for students who have done distance learning masters, like institutes like IGNOU. Um, as a suggestion that I would like to give people who have done masters through distance learning, I think rather than directly applying for MPhil, because MPhil can be really, it can be really overwhelming for someone who has not attended classes or sat for longer hours of education and psychology, which happens in distance learning, where you can take your own time to learn and do all those academic work, so to say. So my suggestion would be take at least a year and a half, probably gain some experience with respect to working longer hours, dealing with psychological, theoretical, practical work. Because then it gets more better for you to know कि अच्छा MPhil में ये होने वाला है, might as well have a hands-on practice for a year to get your work experience as well. Plus, your interview process gets much better because you have something to talk about and validate your learning. So that is something that I would advise if you have done your masters from IGNOU or institutes like IGNOU. But you can definitely apply. Why not? Like definitely, please go apply.
That's a great point. Thank you. Yeah. So, because that was a question between some people. I made a video about IGNOU, and so people were like, yeah, it's acceptable in RCI. Although one person also commented and said that, yeah, but then there are no jobs afterwards because even after MPhil, it's like, oh yeah, but your master's was in IGNOU. So I'm going to make a separate video with someone who has done a master's and now is successfully also working. But it's just also helpful to know from your perspective. And I would want to ask you, why do you think is an MPhil necessary, especially for clinical psychology, if you think it's necessary?
Oh, most definitely. Like, I mean, like, it's most definitely needed because otherwise, you want to do clinical psychology in India, you want to become a clinical psychologist, you have to do your MPhil. Otherwise, you won't get registered. You need a license to practice. So, if just see it, I keep giving this example and parallel of how doctors work and how psychologists work because we both see clients, we both see patients. So if you are okay going to a doctor who has a medical license and who has been specialized in surgery for your surgical issues, and you check their license and you check their experience for that job, do the same for a clinical psychologist. Check their license, check their experience, and that person has to have the license to practice in that field. If that person doesn't have a license to practice, would you as a patient or would you as a person who's seeking their service be comfortable or would trust them? It's a very debatable question. So yes, if you want to see clinical cases, you should do a RCI course, registered course, and do an MPhil so that you can be licensed to basically practice at any given level with clinical cases anywhere in India.
Thank
So
you so much for actually saying that out loud, because I think in my experience also working as a psychologist in India, in my entire, I don't know how, I mean, I have to check how many clients that I must have seen, but there was only one person who asked me about my degree and my qualifications, which I feel, I mean, it's just a cultural thing in India, um, to be very polite, and it's, you just go and trust someone, but 100% please ask for people's, you have the rights to ask for their license.
definitely, like sometimes I feel that even with patients that I see here, like the place that I work right now, even though they don't ask, I just end up saying so that just in case, just in case for whatever reason, um, they need to, tell someone in their family, tell someone in their friends that, you need some help, you need to go to this doctor or this therapist, and this is the qualification you need to look for. So as clinicians, future clinicians, it would be your responsibility to educate your patient about the kind of therapists and professionals they can go to. Even with respect to counseling, right? Like having a MA or an MSc in counseling and completed MA and MSc in counseling, that becomes really important, because I've also heard about cases where people have started practicing after first year of masters, and I've had clients who've gone to professionals like that who are not professionals, and it becomes very important for them to know their rights.
Yeah, please. Yeah, absolutely. Because I'm sure you also must have experienced clients who've been to other therapists, and it's like I'm a strong advocate for, because we are losing credibility sometimes when we just don't do enough. And then there are people saying, "Oh my God, I don't even have the time to go to college. Why do I have to go to, do an MPhil or like further education? Like, I don't have the time. I have a family and I have other things to do. I mean, would you go to a doctor if the doctor said I don't have time to actually go to go to do my MPhil, and just I don't have that time, you just come to me, I'll come and do your, not MPhil, but like say for example
Yes,
MD, you
yes.
know, your internships after that. No, it's so important.
It's very important, and it I mean, the entire point of clinical psychology is that you are eligible to see clinical cases. If you're not exposed to clinical cases on an everyday basis, you don't know depression case, a case of depression looks in a ward as compared to how a depression case looks in the OPD, and how the treatment plans are different for both. How are you going to help the patient? Isn't that like a very basic thing to know?
That's very helpful. And that brings me to my next question, which is like, for example, if someone has a master's in clinical psychology, whether from distance
Mm.
or from a full-time college, uh, and if they don't want to do a MPhil or something, is there a way that they can practice under supervised, licensed?
Yes, they can practice under supervised clinicians. Again, check their credibility and whether their license is still active. So, just in addition to when we discussed about the RCA license has to be renewed every 5 years. So their license needs to be valid. So even if they have gotten their MPhil 6 years, 7 years back, they're supposed to do something known as continued rehabilitation education, and they get points for that. So you have to collect 100 points over 5 years to renew your license. So also check about the whether the license has been renewed. That means they're up to date with the current trends and current researches in the field. So someone who's seeking supervision, ask for that. And if the clinician is not comfortable, there's your answer. If someone is very comfortable and confident about their work and their ethics, I don't think that person will take you questioning them in a wrong way. So please do that. Even for students with psychology, they need to up their game with checking the credibility also. For sure.
100%. In fact, in America also they said even if you finished your PhD, I have a professor who's been like 30 years in the field and still has supervision literally every week. So that is so important. But yeah, this was also another thing is, yeah, a lot of people just say that I just want to work in an organization under the license of a licensed provider. So I think that also is a possibility if they don't want to do MPhil themselves, right?
But one another thing that they can, when they are being supervised by someone, always remember that the supervision is not enough for you to practice independently just because you've taken supervision before. That gets tricky for people to understand. Yeah.
Yeah, so supervision doesn't mean that you can actually start your
Yeah.
practice via supervision. No, you have to work with like under the license. You're working under the license of your supervisor, so you're only working kind of under them, rather
Yes,
than
like
in
under
front.
their supervision, or they're managing the cases that you're seeing, or managing the treatment plan that you are seeing. So they are overlooking your progress as a psychologist. That's it. That's what it means. Even if you change organization someday, you might have to find a supervisor there. So,
Right, which is why if people want to practice independently, I think clinical.
yeah, just do 2 years of MPhil. Just practice on your own.
That makes a lot of sense. Yeah, what are your experiences doing MPhil, and what would your recommendations be for students interested in doing MPhil?
Okay, I'll take the second part of the question first. So, a recommendation for students would be something that I've learned from my experience. I'll like to address that first is MPhil is a privilege. I consider it as a privilege. Most of the people in the field consider it as a privilege because, first of all, currently at this point of time, there are a lot of MPhil colleges opening up. But probably 2 years back when I started my journey of application, there were good, credible colleges, maybe a handful or a little more than 10. So don't restrict yourself to one or two colleges and expect that you will be able to get through the entrance. Go a little out of the way to understand some few questions. Some things like, can your family afford the fees of private colleges? Because it is very important. It's very, very important. And if your family can, your number of entrances that you're able to give increases, which then increases the chances for you to get through an MPhil college. That's first. So sort your finances, talk to your family, see if they can afford the education loan, anything, that financial aspect of it. That's where I say that the privilege comes into picture. So maybe let me give you a number currently in 2022. If you're watching this video in 2022, then it is somewhere the cost in private colleges would range up to maybe on a higher side of 8 lakhs for 2 years. But this is, I'm going on a higher side. Like there are some private colleges which take 8 lakhs for 2 years. So again, that is the privilege that I spoke about.
A lot of money. Yeah, that's true.
Yeah. So talk to your family about it. Have an honest conversation कि this is the maximum जो लगेगा. अगर ऐसा है तो how much can we as a family can afford. तो उसके हिसाब से I will see which colleges fit in, which are there. There are colleges which cost around 5 lakhs also for 2 years. There are colleges which also take 50,000 for 2 years. That's it. So you know your range. So you can start from 50,000 to 8 lakh. Now imagine all RCI institutes have varied fees according to their universities. So अब तुम decide करो तो पहले privilege का बात हो गया about finances. Second thing is it is very important for us as individuals to also know that finances doesn't stop there. It's not only the college fees. It's also if you are ready to step out of your house, how much finances of the hostel fees, of your food, of your stay can your family afford? So even that.
Also, I was wondering if, what do you think, like if people who spend a lot of money, are they able to regain it back with their salaries as a clinical psychologist?
Yes, over the years they can. Yes, most definitely they can. It really depends on what kind of work and what kind of environment, what kind of city, what is the GDP of the city. Everything like salaries in Mumbai will be again different as salaries in Pune or Bangalore, Delhi, Gurgaon. Delhi, Gurgaon में भी बहुत like there's a difference. Noida, Gurgaon में difference है. Like even Mumbai, Pune में difference है. Literally, it is 3 hours away, and you can see a difference in salaries. So yes, you can gain the money back for sure. But are you? Is you and your are you and your family ready for investing that kind of money? So बात कर लो एक बार. See, passion and all के बाद ही ये सारे बातें आती है. तो पहले you first decide whether you want to do MPhil or not, because it's going to be rigorous. It's every day you have to remind yourself why you like psychology, and I've done that every single day for the last 2 years of my MPhil, and you have to keep at it. Every day doesn't look the same. So passion, wanting to do, करना ही है. उसके बाद question आता है, can my family afford?
Yeah.
After that, the question is, are you ready to move out of your city? If there is an MPhil college in your city, like for example, if you're from Bangalore, then there is NIMHANS in Bangalore. But NIMHANS में मिलने के chances कितने हैं? वो भी देख लो. अगर same state में है, so then it increases. So at least if you can go anywhere in India, chances of you applying for again universities increases, chances of getting into an MPhil college increases. If you want to stay in Maharashtra, then hardly 1 or 2 colleges are there. If you want to stay in Karnataka and you are from Karnataka, then you have 5-6 colleges there. So decide if you're ready to move out of your city, decide if you're okay and comfortable to move out of the state where you belong to. अगर second वाला हो गया है, so then the third question comes about the language barrier. Because here you need to learn, you're going to converse with your patient. If you don't understand their language, it's going to go down south. And it gets very, very difficult. So if you are comfortable in English and Hindi, so see colleges where patient intake has Hindi speaking population. And that would be northern side of India. Anywhere, Madhya Pradesh se upar, anywhere. You'll get major population of Hindi speaking. So these are some prerequisites that you need to keep in mind before selecting an organization to even apply. तुम अप्लाई करने से पहले ये सारे चीजें एक्सेल शीट में लिख दो कि क्या है, बात करो, सब्जेक्ट मैटर एक्सपर्ट से बात करो. If you know someone from that, you can easily find people from LinkedIn who have done MPhil in that university. Ask them what is the major language that they speak in that hospital, like the patients speak in that hospital. So for example, I did it from Karnataka and I've done my MPhil in Mysore. So Bangalore mein to still you'll get a mixed population. Mysore, I had to learn Kannada for the first 6 months, which is a completely new language for me. Like even though I had done my masters in Karnataka also, it was in a city where I could get away with maybe Urdu, Hindi speaking population or English speaking population, where the patient population ranged between middle to upper middle class people who at least know some root words of English, if not fluent English. Magar Karnataka mein, Mysore mein, especially to do an MPhil, I needed to learn pure Kannada to speak to patients. So if you're okay with that, if you're okay with learning a new language, you're up to take that challenge along with your MPhil, do it. No problem. It takes a little bit of difficulty, but then at after 2 years, you see that okay, one more language has been added in your CV as well,
That
where
is
your job.
very impressive. That is so impressive to learn a whole new language, and that too language like Kannada. Oh my God, that's
It was difficult, and I still mess up the grammar, but the point is, if you ask me something very important, is that investing like 8 lakhs for MPhil, someone who would have done that in a very good, amazing college, would they get that money back? If you're restricting yourself with few things, then it will become difficult for you to get it back. But for me, because I have Kannada as something that I have learned, or at least limited language proficiency is there, my chances of finding a job in that state also increases. No? What if there's an amazing government job offer? I can I can apply without even thinking twice about it, because what do I have to do? I have to refine my language, which I've already learned. So it's like, fine, okay. So in similar ways, just see if you're comfortable even learning a language. So these are some, I know, like entrance preparation hai, then you have to learn, you have to sit and do MCQ. It's not going to be of any use if you're not going to be able to pay the money for the college, and neither do you know the language. Then what is the use of you preparing so hard?
great, great points. Thank you.
So these are some things. Apart from that, remember that MPhil may any MPhil institute, wherever you go, it's two things. One is interview and MCQ. Interview is completely on you, like you as a candidate. You direct the interviewer. The other way around doesn't happen. So whatever you say, the interviewer will catch it and they will continue from there. So if you say you like personality, the next question, oh, what's the definition of personality?
That, I mean, I've been thinking from the beginning, like, I think there will be people who'll ask questions about entrances and interviews and stuff. And if you would like, or if you have the time to, and like you came today so graciously, I would love to also
Definitely, I will
doing
completely
that
be
with you.
open to that, because that's a completely different, it'll take another half an hour or something for that itself.
Exactly. And I think that will be really helpful. And what is really wonderful, I love your passion and your dedication. I mean, a dedication to learn a whole new language is in itself a whole different thing. And I have been in India, practiced in India, now coming to America. I want to say that such experiences are so valuable even today. It's amazing. In India, that hands-on experience which you're getting every day with your MPhil, like you say, you have to remind yourself why you love psychology every day, but just imagine the experience that you're building. And at the
Yeah.
end of a few years, the powerful therapist that you will be making a difference in lives of people.
Most definitely. And the thing is, when I was in MPhil, like in the course, I did not value it that much, to be very honest. Like I couldn't, because I was neck deep down in work. I couldn't, because there's so much of work, and you have coursework, you have research work, you have inpatients, you have outpatients, then you have case notes to write, then you have to study. And MPhil is not, like, it's not a classroom. So every patient you need to prepare. Go to your supervisor, say that I have learned these things. Do you think that this is apt for the case that I'm going to do or take up, or my next plan of action? And he will just be like, nahi, tum dusra mindfulness based karo, CBT nahi chalega. Okay, drop CBT, sit and learn mindfulness. Then go to him. Then sit with him with the plan. So your initiative and you reminding yourself why you are there every single day is the only thing that is going to keep you going, to keep doing this over and over again. Masters is massive spoon feeding. MPhil is you coming to the game where you are like, okay, I'm responsible for this patient. That responsibility increases, and a lot of dropouts in MPhil also happen for that reason. Like, I know so many renowned institutions in India who have been conducting MPhil courses since 2002 have massive dropout ranges. Like, because people don't, people assume that ये masters का एक same different version होने वाला है. They don't, and I'm so glad that people like you who are taking that initiative to put some material online with respect to, you know, education and MPhil ki, okay, this is what it looks like. Because unless people know it, people will jump on the bandwagon without knowing what they are cut out for, and which is nothing of the people's fault. Like, nobody has been, it's being informed right at the end of the day. So it's
That
really
is
nice.
That is really, really helpful. Thank you so much again for your time. But before, I mean, it's through people like you, experts, because I don't know everything. I only speak about what I know, but it's through people like you that such amazing content is out there. And I'm happy that students are also looking at videos before they get
Yes.
into things. But before I end this session, I want to quickly show Raksha's Instagram page where you can find a lot more. She puts a lot of information about book recommendations and readings. And this is the page called Cortical Connect. You can find it on Instagram, and I think it's just amazing where she has put in so much efforts to, and she's still working. She's just started, but I'm sure that will be
Yeah.
really helpful for students to come and see. And I'm sure that we will have more questions coming for you. So I would love to have you back again. Thank you so much again for your time.
Thank you so much for inviting, and I would love to collaborate with you again on this, because yeah, it's good to know that people like you are out there to really get this done. And I know I before even, like I already told you, like before even coming and agreeing to this, I paid attention to the kind of work that you put in, and that is commendable. Along with your PhD, highly commendable. So
Thank you. Thank you so
definitely.
much. No, I really appreciate this effort, and I hope everybody likes this video too. And people can post in the comments below.